Hey everyone, just working at the computer here. Dr. Olson here, trying to figure out the best way to teach you guys how to take care of this stuff at home. This is pro tip number 4, but it's the second part of yesterday's. Back, neck tension area. When we're all slunched forward at the computer desk or at home, or watching TV, everything kind of slumps forward, okay? Shoulders come forward, arms come forward, neck comes forward. It all puts a lot of tension back here. So what I want you guys to do, obviously everyone knows to sit up. So you're gonna sit up. What we're gonna have you do is we're gonna work on this pec muscle and the pec minor muscle, which is really important to get this backside to relax additionally, even more, okay? So let me show you what it looks like. All right, so right here is this big pec muscle, okay? Underneath that is deep pec minor muscle, okay? If you cut away the big pec muscle, pec minor is way down in there, and it actually attaches to the front part of your scapula on this inside part, okay? So it's deep down in there, all right? So make sure not to push too hard on these structures. They are sensitive, but let me show you how to get those things released, okay? I got my lovely lady here, Miss Rachel.
Hello.
She's back again. All right. So after you've done some self-massage, go ahead and show me that self-massage again back here. You're gonna, again, after you work that spot on that scapula, okay? Yep, you twist through it, you get the arm all the way across, there you go, as you work that spot right there, okay? After you've worked that spot, we're gonna go the other way, okay? So, first stretch I want you to do is arm straight, okay? Thumb rotated backwards, okay? Just let it rotate, and you're gonna imagine there's a nice big door frame or some kind of wall, something that you can kind of stretch. So I'm gonna hold here, acting like that, and you can just twist your body and stretch this out right here. Do you feel that right there?
I feel it.
Okay. Now, your thumb position matters, okay? So if you're twisted forward, you're gonna be able to go a lot farther, but it's a little different fiber, okay? So make sure to watch that thumb. If you feel like it's tighter that way, do that one. If you feel like it needs it this way, go ahead. But most people, it's backwards a little bit, okay? Because everything is coming forward, so we like to get everything backwards, okay? So after you stretch that out, 10, 20, 30 seconds, up to a minute, nice and slow, good. You can add a little bit of the head, good. Add the head movement, good. Now, let it rotate back, stretch it out. You feel that there?
Yeah.
Good. Make sure not to let your wrist come back too far because it'll spike up that nerve a little bit, so don't do that. All right, next we're gonna do is add some rotation, okay? If you bend your elbow and let it come back, this is actually a good stretch. It's a little different muscle. Might get a little of the coracobrachialis in there. That's okay though. We want that pec muscle to feel everything released, okay? Now, if the door frame is stretching you out, go ahead and twist around again. There you go. And you want to add a little bit of rotation to it, okay? So grab a little weight, maybe a band, something that can kind of rotate this thing backwards a little bit. Go nice and slow, rotate it back, and then twist your body. Ready? Go ahead and twist.
I am twisting.
She's twisted. All right?
Okay, so we don't push for that one. It's not pushing this back farther. This stays still,
Yep.
and it just rotates
Rotate it, yep.
on the axis.
And then after you rotate it, then you let it roll. Okay? Again, watch for that rotation, okay? It's really important. Now, self-massage, again, you find tender spots like we did the other days. Go ahead and bring your right hand up here. Feel around, make sure nothing is too tight or too tender. If you find something that is, you lock it down like you are in your normal computer position there. And then after you find that spot, you let it come back while you hold it. You can rotate, you can keep it straight. You got a lot of options, but make sure to keep that spot under your fingers to let it really release, okay? You're trying to get that muscle to relax, okay? Specifically, that pec minor, okay? You can get down in that really deep fossa area. It gets really tender in there. You can find a rib along the way. Find something that's tender, okay?
So just wherever it's tender. You're saying a lot of names, but I just find wherever it's tender.
That's right, okay? And last thing, you can come up nice and tall. That'll get that as well, okay? You can add a little rotation if you want, all right? So again, by stretching out and working on these front muscles, you will feel things relax backwards, and it's really important to get that relaxing, okay? Because if that relaxes, you get tension off of these muscles. So a lot of patients that come in, I'll work this spot, and if we don't get good results, we will work the front, and a lot of times that'll help a lot too, okay? So next we got headaches, sciatica, knee pain, everything that you guys have been commenting, we'll go ahead and knock that out. So again, appreciate everyone. Stay safe and isolate yourselves, but enjoy yourself doing it.